Hi, I'm Dr. Sheena Bhuva, Physical Medicine and Rehabilitation Physician at Texas Back Institute. So today we're going to talk about medial branch blocks and radiofrequency ablations. So what are medial branch blocks? So these procedures are done for people who have what we call axial neck or low back pain. Axial meaning that you don't have any numbness or tingling or pain going into the arms or legs. If you have any of those symptoms, then you would not be a candidate for these procedures. What we usually start with in terms of treatment is physical therapy and medications such as anti-inflammatories. If after about 6 weeks of conservative treatment, you still have significant neck and low back pain, then you'll be a good candidate for these procedures. And what we do first is we look at your history, your physical exam, and imaging. So history meaning, what are your symptoms? What are the symptoms that you tell us in the clinic? So for example, oftentimes people say that they have a lot of stiffness in their neck or low back when they wake up in the morning. They have difficulty with range of motion, such as when they're driving, they have difficulty turning their neck and looking over their shoulders. Oftentimes we hear about people who have a lot of pain when they are doing household activities such as doing the laundry or washing the dishes. If those are symptoms that you're having, then that tells us that probably your pain is coming from what are called the facet joints, which are these joints in the back of the spine that can develop arthritis. So after the history, then we do a thorough physical exam. First, we check the reflexes, your strength, your sensation, just to make sure you don't have any sort of neurological deficits that could be caused from a pinched nerve or a herniated disc. And then we touch the joints in the back and we see if you have any tenderness around that area. We also check for your range of motion. And then I mentioned imaging. So imaging, we usually start with x-rays, but then we also look at more advanced imaging such as MRIs and CT scans. And what we're looking for is if there's any arthritis in the joints. So similar when people have arthritis in their hands, the joints can get really big and bulky and rough appearing. So that same thing can happen in these joints over here. So if your history, your exam, and the imaging match up, tell us that your pain could be coming from the facet joints, then you'll be a great candidate for the actual procedures. So the first is called a medial branch block, or an MBB. Now these injections are strictly test or diagnostic injections where we go in and we numb up the small nerves that go to the neck and the back, the medial branches. And these nerves, they sense the pain from the joints. Since there's no cure for arthritis, what we want to do is just help manage the symptoms from the pain that's caused from the arthritis there. And all these procedures are done under x-ray guidance, or what's called fluoroscopy. And these procedures, as I mentioned, they're test injections, so the relief is only going to last 4 or 5 hours or so. But what we're looking for in those 4 to 5 hours is significant relief of your neck and low back pain, like 80 to 100% relief. So after the procedure, you go home and you test it out. You be active. You do stuff that would usually aggravate your neck and low back pain. And then we talk the next day or so, and you let me know if you get that good short-term relief. If you do, then that's good. That tells us this seems to be where your pain is coming from. The second step is we do the exact same thing again. It's called a confirmatory medial branch block. So this is on a separate day. And the reason why we do it twice is just to make sure that the first time wasn't a false positive or placebo. So we want to replicate those same results again. If after the second test injection you again get that great relief, then we're much more confident that this is where your pain is coming from. And then you'll be an excellent candidate for the actual treatment, which is the radiofrequency ablation, or RFA. The other term you may hear is called a rhizotomy. All it means is the same thing. They're used interchangeably. And for this, what we do is instead of just numbing up the small medial branches that go to the joints, we actually use these special needles and we use heat. So the end of the needle heats up to an area about the size of a large grain of rice. And we burn and ablate those nerves that go to the neck and the low back. And what that can do is that can give you much more long-term relief of the neck and low back pain, anywhere from 6 months to 2 years or so. The average is about 8 to 12 months. Now the relief is not immediate. It takes maybe 2 weeks for you to notice any improvement because it takes that long for those nerves to fully die off and wither away after being burnt. You may be sore for those first few days, but usually people go back to their normal day-to-day activities the next day after the procedure. Now at that 2-week mark, you'll start turning the corner, and week after week after week, your symptoms should start to improve. And usually everything plateaus at that 6-week mark, and then that's where that can last anywhere from those 6 months to 2 years or so. Oftentimes I get questions in terms of, am I put to sleep for these procedures? So for those test injections, the medial branch blocks, since they're strictly test injections, diagnostic procedures, we use just what's called local, where I just numb up the skin. So you're not given any sedation or pain medication during that time. And the reason why is because the relief is only going to last those 4 hours or so. So we don't want any medication to interfere with the results from the test. And then with the radiofrequency ablation, or the RFA, some patients opt to do under just local, where we just numb up the skin. But if you're a little bit anxious about the procedure, we can give you some medication to help with any anxiety or discomfort. So if you feel like you have any of these symptoms that could be emanating from the facet joints over here, we'll be happy to take a look and do a thorough exam and see if you're a candidate for these procedures.